Welcome to the Healthcare Air Deep Dive Podcast. My name is Garth Holmes, and today we have two very special guests, Dr. Ruth Carrico and Dr. Hudson Garrett. In today's episode, we will be talking about IRIS and the Seal of Recognition program. Now, for our viewers, could each of you introduce yourselves and tell us about your background? Dr. Carrico, let's start with you.
Thanks. So my name is Dr. Ruth Carrico. I'm a family nurse practitioner from Louisville, Kentucky, and an adjunct faculty in the Division of Infectious Diseases in the University of Louisville School of Medicine. So I've been in the field of infection prevention for more than 35 years with an emphasis on how do we protect patients, healthcare workers, and communities.
Thanks for the introduction, Dr. Carrico. Now, Dr. Garrett, could you tell us a bit about yourself and your background as well?
Sure. So much like Dr. Carrico, I'm a family nurse practitioner by background and also adjunct professor, assistant professor of medicine in the University of Louisville School of Medicine in the Division of ID. Dr. Carrico and I both share a passion for breaking down barriers and infectious diseases. And specifically, I think that's what drew us both to IRIS. Was really that interaction amongst the continuum of care where evolution of healthcare is changing daily. And so that's really why we're passionate about this particular topic.
Thank you for that introduction, Dr. Garrett. Now, Dr. Carrico, could you tell me a bit more about IRIS, which stands for the International Respiratory Infection Society? And also, what is your main focus and priority in terms of prevention of infectious diseases?
Yeah, I'd love to. So IRIS is a nonprofit that was started actually by an ID physician and researcher from outside the United States, recognizing that, since you can be anywhere in the world within 24 hours, what goes on anywhere in the world impacts the rest of the world. And the idea is that how do we bring together researchers, educators, clinicians, those that are interested in improving health and health outcomes? How do you bring them together for some collaborative sharing? So the vision of IRIS is really to improve health and health outcomes through research, education, and training in the fields of respiratory and other infectious diseases. And to do this through collaborative approaches, educating and engaging healthcare professionals, having a place where people can come together, bring ideas, discuss, and then post and share successes and what we have learned in working together.
Now, further to that, Dr. Garrett, could you describe the reason for the creation of the IRIS Seal of Recognition program and how it benefits healthcare facilities?
Sure. So, in healthcare, we have historically had a more punitive culture in it in terms of accreditation and surveys. And that's something that both Dr. Carrico and I really aim to change. We want to reward people for doing the right thing and especially going above and beyond the established standard of care. And air quality has been a real big moving target for healthcare. If there's one thing that we've learned post-pandemic was the role of the air has evolved, it's changed, and we've better understood it from a scientific perspective. And much like water, it's one of those utilities that we're exposed to continuously. And air is something that impacts, the healthcare providers, it impacts the visitors, and it also impacts our patients. And so it's one of those facets of healthcare that we simply can't ignore. And so the Seal of Recognition program was created with really sort of two core objectives. One was to raise the bar, if you will, for healthcare air quality across the entire continuum with a particular interest in procedural areas. And we really, at IRIS, use the definition that CMS follows for procedural areas. So that's not just operating rooms, but it's anywhere that procedures are performed, like interventional suites, GI labs, outpatient facilities like ASCs. And the second objective, which I think is particularly important, is to create a transformation with industry where we can have industry engaged in providing innovative solutions for healthcare facilities. There is a very big difference in the term vendor or supplier and industry partner. And Dr. Carrico and I both have worked with both. And many of you listening to this podcast may say, wow, I can really see the difference between those two. A vendor or supplier is one that moves a widget. An industry partner is one that comes to us and says, we'd like to be deeply integrated in providing solutions, right, to the needs that are most important to you as a healthcare facility, whether that's reducing surgical site infections, improving air quality, reducing the risk occupationally to our nursing staff, as an example. That's an industry partnership. And so the program was really designed to really tackle both of those core challenges and bring that information to the front lines of healthcare where patients and healthcare providers could be equally protected.
Tell me, what types of healthcare facilities should pursue the Iris Seal of Recognition program?
Sure. So, I mean, when we think of the term standard of care, right, there's a really big importance to that. Every patient comes into healthcare and expects that we'll give them our absolute best. As one of our mutual colleagues for Dr. Carrico and myself, Dr. Michael Bell at CDC has talked about for years, patients expect perfect care. Right? They come with an expectation of safe, reliable, efficacious, and we also want to add cost-effective care, right? Especially here in the United States. And so one of the things that we can do is to make sure the environment that they're exposed to and also the environment that our healthcare workers are exposed to is going to be as safe as possible. And so when you think of specifically sort of healthcare facilities, it's not limited to a specific type. So whether it's an acute care hospital and all of their procedural areas or an ambulatory surgery center, it doesn't matter. The patient is the same, right? The expectation of safe, reliable, and efficacious care is the same. As my younger brother, who is an attorney, frequently reminds me, it doesn't matter where you have health care or where you receive it, he'll still come after you as an attorney if you breach standard of care. And while I'm not a huge fan of that approach per se, I think there's a lot of value in what he says, right? Because he's holding us accountable to the fact that it doesn't matter where the patient enters the healthcare system. Their expectation is that they're going to receive something that's going to be, good and solid and rooted in evidence. And that's what our goal with this program is to provide facilities with access to interprofessional information across sort of all the different disciplines, whether it's perioperative, infection prevention, or building services, and to build a robust program that helps reward facilities when they're doing the right thing to catch them doing something right. And we found that approach is far more successful, right, than more of the punitive approach, pointing out things that facilities are not doing well.
Thank you for explaining that and also outlining that very positive approach. Dr. Carrico, could you tell me about the types of clinical standards that this program is built on?
Yeah, and I think, what is interesting about respiratory infections is that you can't see them. Other infections we know share that same challenge, but we're asking people to do something to prevent something they can't see. And that abstract concept is quite difficult. And so, in order to be successful, it really brings home the importance of having a standardized approach. We have a problem you can't see, but we know that if you deviate from what the evidence shows us as protective activities, then you have a greater likelihood of your patient and your healthcare workers and maybe even communities experiencing harm. So this really presses home the importance of let's stick to the evidence. So the evidence then is outlined in several important standards, and these standards kind of stretch across both different areas of care, different accreditation processes, different groups that we know are deeply rooted in evidence-based care. And these include, and I think probably the one that just comes to mind the most is the AORN. The AORN standards that really have a long-standing approach of saying, we have a conscience about how care is provided. We then hold you accountable to this conscience. And here then is the evidence behind that. So we have then our AOR standards of what our operative environment should look like. And then we have ASHRAE standards that will say, here are the standards that we should see in the sharing of air within a healthcare organization or a facility. And both of these then demonstrate then the importance of having then an approach that is going to be transferable. It may not be in an acute care setting, operative environment. It may be in a freestanding surgical setting, or it may not be air in, again, a hospital setting or acute care. It may be in critical access or a community hospital as opposed to a major medical center. So it really says that when you have an environment in which care is delivered, we need to then use the evidence-based approaches that have been embraced and many times well articulated and well referenced by our partnering organizations. Now, no, Hudson, Dr. Garrett, you have then a lot of experience in working with these groups. So I'd love to get some additional comments from you about some of these standards and some additional standards.
Sure. So, I mean, if you look at the operating room, I think to your point, that is a perfect mecca for the need for interprofessional collaboration. And, ARN has done a phenomenal job of building evidence-based practice guidelines that help us guide in that sort of perioperative practice. But I think one of the things they did uniquely here with the sterile technique guideline is they brought in other groups like infection preventionists, surgical technologists. They looked at surgeons themselves and some of the other groups that are critical to this conversation. I've learned from the best with Dr. Carrico, and one of the things she's always taught me is it's really about bringing the right people to the conversation the first time. I've watched her do that in her career, and that has yielded tremendous results. And that's absolutely the aim of this program, is to help facilities bring the right stakeholders to the conversation the first time. And that way, the patients and the folks that are in the rooms are winning the battle, if you will, against surgical site infections as well as other, preventable, whether it's an outbreak of an infection or frankly, dangerous VOCs or things like formaldehyde. These are all risk factors that in many cases are completely preventable. And it is a great conversation to be able to go back and have and say, not only are we meeting the evidence-based standards and the guidelines, right? And yes, we're checking the boxes for our accreditation and regulatory requirements, but we're going above and beyond that. And that's because we care about you. We care about you as our staff members. We care about you as team members and clinical care partners. And we also care about our patient. And that is the sweet spot of healthcare and very much the sweet spot of the hours program.
So it's like pulling people out of their, we all have our practice silo where we feel like, okay, I've got a great deal of knowledge, but it is within these confines. So this program then says, hey, wait a minute, there are many others that are part of the solution for this problem. And so let me take down this wall of my silo so I can pull you in and I can learn then from you. I can take advantage of your area of expertise. So then together, collaboratively, we're able to address a broader problem or a problem that is broader than any single group's area of knowledge or competence.
Thank you for outlining the foundation of the program. Dr. Carrico, who are the key stakeholders that should be engaged in the program across the healthcare facility?
Well, I think, I like to say that, as a nurse practitioner, as a provider, my responsibility is to the patient. And certainly then how we deal with the patient, how we address the patient, how we care for them is within my skill set. But we also then have groups whose skill set involves another patient, and that happens to be the healthcare environment. It also is a living organism and has very different yet very specific needs. So our stakeholders will include not only those who physically touch the patient, but those who are also responsible for the healthcare environment. So it will include the clinicians as well as those who look after the healthcare environment, particularly those that are responsible for air quality. So it may be those that are in plant operations or facilities management, those that have an environmental services component, those that are in the operative environment, looking at the workflow as well as the actual care that is provided. So this program, I think a unique aspect of this program is it began with a step back to say who is involved in the care of a patient within very specific areas of the facility, and then what is involved in the care of the facility itself. So pulls together those with a very high clinical focus, as well as those that have expertise in the actual healthcare environment itself. Dr. Garrett, what else?
For me, a lot of times it's about personality. And I think to her point, you're going to have folks that come to the table with specific skill sets or even interest. But in so many facilities, there's also politics at play. And so understanding the politics and sort of who's going to be the best champion is a critical element of this program. And then in some cases, that may be the perioperative nursing leader, it may be the infection preventionist, or to Dr. Carrico's point, it could be building services. And so knowing who is going to be that best champion, I think is really critical for success. ASCs are another perfect example where, they're smaller environments, they're more limited resource, and they are all about throughput and efficiency. And so this is a program that not only helps in terms of reducing infection risk, but if you think about it on a broader scheme, it also is going to improve operational efficiency. It's going to improve your reputational management of your facility in terms of making sure that your patients and their families understand that you're doing something above and beyond, right, to protect them. So, whether it's an HCAP score or leapfrog or something of that nature, these are all elements that we should be thinking about even more broadly in terms of that greater healthcare value conversation, because patients are looking for what's the value of the healthcare that they're receiving. And that value proposition is defined by them. It is not defined by us. And so, whether it's, like I said, infection or other outcome measures, those are critical conversations for us to have.
So it seems like, if I'm listening to your words, it seems like that just reinforces our thought that this year in particular is a new age. It's the age of collaboration. And so we look at our organization, we kind of understand how we operate within our unique organization, and then think about who are our collaborators, who is going to help us achieve this goal of best patient outcomes, safe outcomes, inclusion then of those who have then new ideas or new approaches, but it gets us out of our old way of doing things. And that what is the new way of doing things? How do we pull in people that have areas of expertise, recognize then these new areas of expertise, be willing to listen and to learn together, and then reestablishing, what is our true north? Our true north is how do we provide the best care for the best outcomes consistently, reliably, so that our patient then is able to leave our facility in the optimum health, the best possible outcomes. Together, then we make this happen.
Thanks for that great answer and also the collaboration between you both. Dr. Carrico, I really loved how you called the healthcare environment a patient. That's a very good perspective. Now, Dr. Garrett, I'll start with you for today's last question, which is, what types of infections and patient outcomes can the IRIS program assist with improving?
Well, the paintbrush can be quite broad with this one. I think historically we sort of, latch onto surgical site infections, right? Because that's really one of the most tangible. And if you look at the literature review as well as the ARN guideline for sterile technique, they have a whole section on this, right? In terms of correlation of surgical site infections and contaminated air quality in the perioperative arena. And so that's sort of the first soiree. Now you've also got pending HICPAC guidance that's coming out from CDC in terms of airborne isolation and how that relates to transmissibility. That's another sort of element from this perspective. But I would say let's even go a step deeper. So many infection preventionists are highly focused, right, in terms of compliance of NHSN, which is the National Healthcare Safety Network data, in terms of providing that input, making sure they're meeting the reporting requirements. Well, as Dr. Carrico and I frequently discuss, that is not infection control. That is more of a surveillance function. It's retrospective. It's not allowing us to proactively go down into a clinical unit and you really make true transformational change, right? And say, wait, we've got a problem here in OR3, or we have a problem in this ICU. And so we've got to move and sort of shift. And I think that's a really critical component with this is how do we improve other types of outcomes? In healthcare, we are notorious for starting new initiatives, committees, programs, whatever you want to call it. What we're not so great at is getting it over the finish line and then maintaining it as part of our culture. Hand hygiene is a wonderful example of this. We still have what I would consider fairly abysmal hand hygiene compliance rates in a very modernized healthcare system. And one could argue why that is. Well, we've got great products. We've got accessible products. We certainly have expectations. We have, good training. So all of those elements are there. So it goes back to cultural and sort of accountability. And when you think about the IRIS program, the whole goal of the program is to provide the accountability at the unit level. It's almost like the CUS program that was built out of Hopkins years ago. We want to make sure that the folks that need to have the authority and the autonomy have the tools and resources. And what I think is very unique about the IRIS program is it's the only one out there that brings all the different standards and the guidelines together, brings the people together, and it brings the expectation of shared accountability together. And that's going to reduce infections, which is great, but it's also going to improve accountability, which is also good, and it's really going to reduce preventable harm and cost. And if you look at some of the new things that are coming out from CMS just recently, like the new team-based model, where there's going to be 5 episodic sort of levels of care that we're evaluating, where there's going to be reduced payment if we don't get on board with collaboration. This is absolutely the time to start this type of program in a healthcare facility.
I think it also brings in some components that you, Dr. Garrett, have long championed, and that is the notion of human factors engineering. How do we make it easy for people to do the right thing, and how do we make it hard for them to do the wrong thing? And so bringing in a program then that initiates very particular and specific environmental controls makes it then easy to do the right thing because
Yeah.
we've made it difficult then for the environment to negatively impact the patient. And then developing standards, having procedures in place, having policies in place, having this integrated and hardwired into workflow. That again makes it easy for the healthcare worker and the team to do the right thing, makes it easy for the environment to provide the right conditions, and makes it then difficult for the conditions to be present in which healthcare associated infection can occur, thrive, be transmitted, and then be part of a process that then is very difficult to break. So it brings in then the importance of recognizing the evidence, applying the evidence, ensuring that those evidence-based practices are consistently applied. And then it helps then show the individuals within those settings, what are those components? Why? The why behind all of these components. As you mentioned, Dr. Bell at CDC was just instrumental in really bringing in the whys behind healthcare associated infection prevention activities. And it ties all those into a very nice package that demonstrates how you can apply these approaches and address a problem you can't see. So now you don't have to see a problem occurring. You can then you can rely upon these sets of standards and approaches and then be able to enjoy the successes that we all want. And that is, again, our optimal patient outcomes and safe care that can be provided both for patients and for the healthcare workers that are working every day to deliver that.
That is wonderful. Thank you for those insights and sharing about IRIS, the IRIS Seal of Recognition program, why it was started, and the standards it is built upon. And I also want to thank you both for what you are doing in the healthcare industry.
Yeah, one thing I did want to add, Garth, is I know we've had a lot of questions about facilities saying, I don't necessarily have a program. Where do I start? That's another advantage of participating in the program because just as much as the program wants to drive collaboration at the facility level, we will also collaborate with participants in the program to help them really create those best practices. And so, Dr. Carrico and I have created a template that's available to folks that are participating in the program that helps drive those best practices. It's rooted in the evidence-based practice out there, but it also helps facilities meet and exceed those evidence-based guidelines and regulatory and accreditation standards too. And so, to have something like that as a template is a huge game changer, I think, because healthcare folks don't have free time. When somebody says, "Oh, well, go start a new initiative," that's the worst thing you could tell to a frontline leader, because they just don't have the free time. But to say, let us engage with you in a collaborative effort to improve safety for your patients and your healthcare providers. And oh, by the way, there's a supportive infrastructure that will help you get across the finish line and be successful. Now we're talking about true interprofessional collaboration. And that's what's going to not just move the needle, but it's what's going to keep the needle at zero for these preventable harms that are occurring in healthcare every day.
I love the way you said that because many times, organizations will have a number of these elements already in place.
Right.
They don't know what they need to kind of help them get to a next level. Or maybe we have organizations that have really good programs in place. Well, let's highlight that and provide them then with the ability to say, let me showcase what we are doing. So recognizing that every organization is not at the same place with respect to, their approaches in providing then this level of quality in this particular area of practice. So it enables then different organizations to take advantage of what they have, what they need, and then to be able to reach out then to individuals that want to help them to get across that finish line and be able to kind of wave that flag to show what they are doing and what they have accomplished.
So, what is the next step for facilities that do not have a program and want to learn more and get access to the resources that are available?
Sure. So, really the first step is you can reach out to your aerobotics representative and they can connect you with the resources. It's a two-step process, actually, as you see in our background here. The first step is to submit your online application, which will trigger sort of that preliminary online assessment. And that assessment is interactive. So think of it as an iterative review where we go back and forth with you as a participant in the program. And as Dr. Carrico mentioned, everybody's going to have a different baseline. And so your baseline may be, I have no resources, I have no tools, I have no program yet, but I'd like to get there. Or you may have some of those critical elements, but you'd like to beef up a few extras. And so that process usually takes 1 to 2 weeks. Once that process is completed and we have all that documentation, an on-site audit is scheduled where a specially trained representative will come out to your facility and use an established checklist, which we'll provide you ahead of time. And that on-site audit is conducted much like an accreditation audit, but with a consultative approach, right? And our goal is to catch you doing the right things. And so these should be things that you're already doing correctly, like your temperature, your relative humidity, capturing air quality reports, making sure that you're monitoring door openings, which we know is tied back to, increased risk for surgical site infection. And then as soon as that process is completed, you are issued the seal of recognition as long as you meet all of the requisite criteria. That seal of recognition is valid for a period of 12 months, and then you have the opportunity to renew that. And then there's some publication that goes around that to ensure that you receive the recognition that you deserve as an outstanding recipient of this seal of recognition. It's again designed to recognize excellence, promote evidence-based practice, and most importantly, to protect patients and healthcare workers at the front lines.
Perfect. Well, thanks again for joining us on today's podcast. If you'd like to learn more about the IRIS Seal of Recognition program, I would encourage you to visit safehealthcareair.org for more information and to start your application process today.